Welcome guys, I'm Dr. Mwirigi. Today we are going to discuss about peptic ulcer disease, PUD. PUD classically presents with epigastric burning or pain on the epigastrium region and is actually relieved or worsened by food intake. And there are two types of PUD. One is duodenal ulcer, the other one is gastric ulcer. The duodenal one is actually relieved by food intake. That means when you take food, you feel better. The burning sensation that you end on the epigastrium region is actually improved when you take food. The gastric one gets worse. That means you tend to get more epigastric burning when you take food, other than when you have an empty stomach. So the common cause of this PUD is actually H. pylori. The Helicobacter pylori is the most common cause of PUD. So in terms of investigations, the first investigation that we check is the H. pylori antigen test, which is the most reliable and accessible in Kenya to diagnose an active infection. The other one is the upper gastrointestinal tract endoscopy. Gastrointestinal tract, it includes the food pipe, that is the esophagus, the stomach, and the upper part of the small intestine, known as the duodenum. So the endoscopy is actually a procedure that visualizes the digestive system. The other test that we do is urea breath test. Urea breath test is a test that tests for urease enzymes produced by the bacteria. And what are the causes? As we said earlier, the most leading cause is H. pylori bacteria. So H. pylori bacteria, these are bacteria that causes infection on the stomach linings. The other one is chronic use of steroids and non-steroid anti-inflammatory drugs, alcohol intake, and remember also cigarette smoking contributes to development of peptic ulcer disease. What are the treatment regimes that we use here? One of the treatment regimes that we use is the proton pump inhibitor, whereby we combine them with an antibiotic. Proton pump inhibitors, you can either use lansoprazole 30 milligrams 12 hourly for 2 weeks, or you can use omeprazole 20 milligrams 12 hourly for 2 weeks. Then you can combine them with the clarithromycin 500 milligrams 12 hourly for 2 weeks, and amoxicillin 1000 milligrams 12 hourly for 2 weeks. Then on top of this, you need to add an antacid. The aim of adding an antacid is actually to reduce the level of acidity that has already been produced by either this bacterial use of these drugs, and is causing the damage on the stomach linings. So remember, the aim of treatment is actually to relieve the symptoms and to eradicate the bacteria. To eradicate, that means you get rid of this bacteria that is secreting excess acid. What are the complications? If there is inadequate treatment of PUD, there are complications that follow. One of them is bleeding. Remember, these ulcers may erode the adjacent blood vessels that supply the stomach and the duodenum, that may lead to massive bleeding, and hence you present with shock. The other one is the perforation. These ulcers, they may eat through the walls of the stomach and the small intestine, that may lead to perforations, and hence you might get yourself into a life-threatening state known as peritonitis. So, and the other one is the obstruction. Remember, these ulcers, they heal by a process known as scarring, and they may, when there is scarring, they can develop strictures, which may lead to development of obstruction. So you need actually to treat this disease, and remember, if it's well treated, you get well and you get into a normal life, so you don't have to take drugs for life. Thank you very much, guys. Let's keep learning and understanding our healthy state, and knowing how we can improve ourselves without suffering, to improve the quality of life. Thank you very much, guys.